The management of radiology requests is a very complex and distributed workflow, often relying on physical artifacts and time-inefficient phone calls. Using Rapid Contextual Design and a focus group, we improved this workflow and developed new desktop and mobile user interfaces, which are well received and achieved high usability while causing low task load. Remote prototype testing yielded equally good results and higher participation rates than in-person testing. In the end, we proposed 5 best practices for remote prototype testing in hospitals.